Okay, guys, sorry. Here I am again. I lied. I'm not done. I realized that I forgot my plan of care and to talk about anticipatory guidance. So, after we were done with the physical exam, it's important that we communicate to the parents any anticipatory guidance. And so I would educate the parents on the need to do hand washing, make sure that they always wash their hands when they're going to handle the baby. Anybody that is going to hold the baby, make sure they wash their hands, because we don't want the baby to get any infections. And we also want to make sure that babies put in their back to sleep. We want to prevent SIDS and or a sudden infant death syndrome, and we want to encourage them to make sure that the baby has his own appropriate space to sleep in, and that if it's a crib or a bassinet, that there's no blankets in there, that it's basically empty, no toys, no cushions, no pillows, anything that might cause the baby to suffocate. And we also want to encourage them to not use any blankets, because baby could cover their face with the blanket. And basically the best thing to sleep the baby with is just like a one piece, like pajama, that's nice and plush, kind of like a blanket type. Those are the safest kind. And also we want to make sure that we educate the parents on tummy time. It's very important for developmental reasons, and to help the baby gain strength in their core and in their neck muscles, so that they are able to continue advancing in their development. It's very important for them, so that they can go on to walking, crawling, and then walking. It also develops the brain to do tummy time. The other thing that we do want to talk about with the babies, with the parents of the baby, is the importance of taking a CPR class, and taking a class for car seat safety, because the instructions that the car seats come with are not very clear, and if you have never taken a class yourself to learn how to install a car seat, I really encourage you to. When I took a class myself for work reasons, I was really impressed on. I was like surprised that I didn't know how to install a car seat, and I had already had 4 children, and thank goodness I never got into a really bad car accident with them, because they probably would have not survived. So I can't stress the importance of importance that the importance of having these classes, for the baby's survival in case of a car accident. We also want to make sure that the child gets cocooned by the family, that their caregivers and people that are going to be around the baby, that they take their flu vaccines, that they take the Tdap vaccine to protect the baby against pertussis. And we also want to encourage them to take COVID tests, or to make sure that they're not sick with COVID, or that they take their COVID vaccines also. We want to also educate the parents on the upcoming vaccines. They're 2-month vaccines. They are going to have a series of vaccines until they're 5 years old or 6. So we want to prepare them ahead of time, and talk to them about the importance of vaccines, and to protect them against serious illnesses, and kind of, you know, how to take care of the baby when the baby gets vaccinated. Those are very important topics to talk about with our parents. And also in my plan of care with the patient that I just saw with the baby, I would order some labs. I would check for bilirubin, since we know that he's a little bit jaundiced, and I would make sure that a lab test was done for bilirubin to rule out a hyperbilirubinemia, and that way we can know if there's any need for further treatment. And I would also at this point do a CBC or a glucose test, just to have them as a baseline to make sure that, you know, baby's within all the normal limit or normal lab values that we want to see. And then also a very important one is to, because mom is breastfeeding, we want to encourage her to give the baby vitamin D supplements. There is usually like about 1 ml drop into their mouth and on a daily basis, because breast milk is lacking vitamin D. If it's a formula-fed baby, we don't, you know, we're not concerned about the vitamin D, because the formula is fortified with iron and vitamin D. So, but in our case, she is breastfeeding, and we want to make sure that she is giving it to the baby. And that's it. And thank you very much. Bye-bye.